Hi, this video is the hair transplant restoration surgery. Uh, we're gonna repair. She actually had two type of surgery in the past at other clinic. One's at scalp lowering, and it left her with a lot of scarring. Uh, and then it still have normal hairline. Number two, she had it done hair transplant again by a plastic surgeon. Again, the plastic surgeons, they're great, but they can perform a lot. Facelift, brow lift, liposuction, a lot of nose and everything else. However, um, they can do hair transplant. You want a specialist, so you don't want a jack of all trades, master of none. So a surgeon who specializes only in hair transplant and can tend to produce better result than surgeon who does everything. So again, I've been a specialist for specifically for hair transplant for 20 years, so that's all I do. So my goal is to give her a more feminine hairline. So if you can notice that we, so her previous surgery with scalp lowering, they leave her a very prominent scar in the front, and numbness, and it caused shock loss. So and then afterwards, she had a hair transplant in other places, giving her poor density and a very natural hairline. So my goal is to bring in the temple, to make it proportional vertically and horizontally as well, and then to transplant and to increase overall density for overall. If you can turn face toward the camera, so there it is. And so we drop the hairline slightly, not a lot, just to hide the scarring in the front. And number two, to hide the plug that was done by another clinic. So we were feathering a lot of baby hairs, so it looked very natural. And they were followed by root to coat 2 or 3 hair, forehead and the back for bulk and volume and density. So we want to increase overall density. Precise angle of the hair is very important. Start around 35, 45 in the front, turn back, increases. On the side, it would be flat down, pointed backward. You're going to see the difference between a surgeon who specializes in hair transplant only for 20 years and specializes in woman hairline versus surgeon, do everything else but not specializing hair transplant. Again, scalp lowering, where they cut the skin and lower it, those are very old archaic technique. Most people don't do that anymore because that leave a lot of scarring for a woman, and you don't want scarring in your face. Number two, the reason you do hair transplant to lower the hairline is to be able to pull your hair backward in a ponytail. But because there's a scar in the front, you just can't wear your hair back. And number three, it causes a lot of shock loss and you lose a lot more hair. And number four, you on top of that, not only it will cost you more because now you pay to lower the hairline and you have to pay a hair transplant to hide the scar in the front. So, or do it right to begin with and do a hair transplant only, and it can work very well. So this is the before attempt to fix other clinic hair transplant and scalp lowering. Thank